Welcome to this place of possibility. This is love's hearth, the home of hope, a refuge for minds in search of truth unfolding, ever beautiful, ever strange. Here, compassion is our shelter, freedom of our protection from the storms of bigotry and hate. In this place, may we find comfort and courage. Here, may our sight become vision to see the unseen, to glimpse the good that is yet to be. Our speaker this morning is Cheryl Ann Kary. She is an enrolled member of the Standing Rock Sioux Tribe. She holds a Bachelor of Science degree in Communications from the University of Mary, as well as a master's degree in management and an MBA. She received her Ph.D. in Communications and Public Discourse from the University of North Dakota, and her dissertation focused on cultural speaking styles. Cheryl is the executive director of the Sacred Pipe Resource Center, a nonprofit seeking to improve civic and social engagement of Native populations in the Bismarck-Mandan area. Cheryl received a Bush Foundation Fellowship in 2013 to develop and administer a first-ever community-wide survey of American Indian people in the Bismarck-Mandan, which served as the foundation for establishing the SPRC. She was named an ODA Builder in 2015 and recognized for helping build community through her work with SPRC's community engagement teams. Cheryl is also a mother, an avid reader, a softball player, an introvert who likes peopling in moderation, and a hopeless optimist. Please join me in welcoming Cheryl Ann.
First of all, I wanted to thank you guys so much for inviting me to come and talk about my passion. I do enjoy peopling in moderation, but I really love talking about my passion, I guess as anybody does. And so I really appreciate the opportunity to come and talk about that today and share that with you, some of the things that we're doing. So the primary topic is really about health. And some of one of the big initiatives that the Sacred Pipe Resource Center has around health. But as I was kind of reflecting on the story about the chameleon, superbly acted by those young men, it occurred to me that this search that we all have for what is it that's going to make us happy, as we look around in this world and see all these other things that we could be, and maybe we look with envy, maybe we look with longing. But that whole search to be comfortable with who we are, to be happy with who we are, and to really realize our own gifts in the world, I think that is really what health is all about. And I've been thinking about that a lot this last week because it's been kind of a week of chaos. It's been a week of fear, a week of anger, hostility, people acting out in different ways. And I think nowhere does that really kind of hit home here in North Dakota than with our Native population. We've had to deal with a lot of anger and a lot of fear over the years, a lot of trauma. And I think a lot of that has led to the health issues that we see in our communities today. And so this whole explosion of these negative feelings really has made me think about how important that health is and how important that view of who we are and what we can give to this world comes back to health. So I want to tell you a little bit about the journey. We mentioned in the intro about how the Sacred Pipe Resource Center got started, and really it's still in its beginning stages. We're going into our third year of operation now, and we've only really been able to be a part-time executive director of the organization, although sometimes that means full-time too. So a lot of the work that I've been doing has been around these things called community engagement teams. And there's 3 teams. One is youth issues, wanting to address the number of youth that are overrepresented in foster care, in juvenile justice, and in suspensions and interactions with police and school expulsions, things like that. The second one is cultural events, where the community, the Native American community, really wants to see themselves reflected in the Bismarck community. And then the third one is the health issues. So these are the 3 issues that the Native population in Bismarck-Mandan saw as the priority issues. And from the beginning, the community health engagement team has really looked towards a vision of having a community health center. And when we talked so we've been having meetings throughout the year, last year and a half or so, about what does that look like? What does that community health vision look like? And it's interesting that health vision goes way beyond physical health. And I think that vision of health goes to the idea of that story about the little chameleon, just wanting to be who he is. Just wanting to, and then finding that happiness with who he is. I think we, in the Bismarck-Mandan community, we have a significant Native American population here. But we're also, nationally, urban Indians are called the invisible population. And a lot of that is because when we move into the cities, we no longer see there's no longer physical manifestations of the poverty and the poor health and the harsh realities of that poverty, the social ills that come along with that. So we can go to the reservation and we can easily see those things. And they're a little bit harder to see in our populations when we move here to Bismarck-Mandan. When we live here in our apartments, our houses, or whatever, it's a little bit harder to see that. But the people who move here bring with them that same pain, that same heartache, those same problems. And those things are manifested in their health. And so the idea that the community engagement team brought to the idea of a community health center is that it would be a place of total health and wellness, not just physical health, but a place where we can go and have spiritual practices, where we can meet with holy men, with spiritual people who can give us advice, who can provide the ceremonies that provide that spiritual healing. It will be a place to counsel young people about relationships and how important they are. It will be a place to counsel young mothers about our traditional practices of children being sacred and how we raise children in a sacred manner. And so the idea of the health center goes beyond just providing a doctor and providing an exam room and providing tests that they can do. It goes to healing a whole person and helping that person find out who they are and be happy with who they are. And I think that this dream of a health center that will serve Native people is one, it's a little ambitious. In fact, it was interesting, we've had one of the grantors that's providing some funding for us recalls the days when she first came, we first met when Sacred Pipe first started 2 years ago, and I had a meeting with her and I said, yeah, our dream is to have a community health center. And she only told me a couple months ago when we visited with her about the funding that in her mind she said, yeah, good luck with that. Luckily she didn't say it at the time. But so what we did was got together a group of people who are very interested in health for Native Americans and other disadvantaged populations. Of course, our focus is Native populations, but it's also for other underserved populations in Bismarck-Mandan. And we got this group together, and we heard a lot of negative stories. We heard a lot of that isn't going to work, it isn't going to happen, there's too many barriers, but we kept going with it. And eventually another organization stepped up, Northland Community Health Center, and they offered to write a grant called a new access point grant. So rather than starting from the ground up and getting all this infrastructure in place for a community health center, they would basically start the center as a satellite community health center. And basically all they needed from us was the statistics that we have. I did the survey, as was mentioned in the bio, I did a survey in 2014 of the Native American population and found that the health issues of Native American people in this community are significant. A little over half of the population do not have regular checkups. About 70% of the population do not have not had health, have not had dental or vision checkups in a year. So all of those health issues can become real crisis issues unless we deal with them with a community health center that's available for us in the community. And so we continue to work on this vision with the Northland Health Center. And I think it was, I really feel like most of the work that I've been doing has been guided in a spiritual sense. Because when we first started working on this project and people were getting excited about it, they said, we'll apply for a HRSA grant, and everyone was like, yeah, let's apply for this grant. And then they said, well, one just came out, so it'll probably be a year or two before another one comes out. And so it just kind of, everyone was like, oh, okay, great. But we continued to meet. We said, we'll do health fairs. So we started doing little mini health fairs and inviting Native people in and service providers, connecting them to the services that are currently being provided in the community. And the day before we held our first American Indian Health Fair, I got a call from a representative from the Northland Community Health Center, and she said, this is the weirdest thing, but a new access point grant just opened. And so I just got chills when she told me that, because I thought this, like a lot of things, I think we have to be spiritually guided, and especially when we're talking about things like our holistic health. And so so we wrote the new access point grant in the middle of July. It's under consideration right now. It's going through the granting process. We will hear about the grant in end of December or early January. If we get the grant, we'll have 120 days to get it up and running. So, so we'll need another few miracles. So our prayers, first of all, are that we get the grant, that it's looked on with favor. Our prayers, if we get the grant, are that we can get it open in 120 days. So we've had a lot of angels that have come along the way. One of those angels is the Otto Bremer Foundation, who is committing dollars to help with the renovations. If we get the grant covers the costs of operations, so it would cover the cost of the staff, to staff the health center, the doctors, the receptionists, the nurses. It would also provide for all the medical equipment that goes into the health center, but it wouldn't provide for the renovations that would have to occur. We do have a location chosen. It's in the old Dakota Foundation building, so it's right in the South Bismarck area, which is where a lot of Native people reside. So we were looking specifically for that. And it's actually a really beautiful space. It's ready to be renovated. Luckily, nobody's been looking at this space to date, which I also think is another blessing. So once we hear about the grant, we can start fundraising for the renovations. And so that's our other prayer then, is that we need to do fundraising to get together approximately $500,000 to do renovations. The Otto Bremer Foundation has already committed $200,000 for that, for those renovations. So that's one of our angels. But I wanted to share that with you to let you know what's happening in the community, and that hopefully you'll be part of that journey. I think that the work that you do here in spreading that message of, as the program, health and hope and humanity, I think that's all locked up in this project, that it goes beyond just a prayer for physical health, but a prayer for health and healing in our community that is in desperate need of healing right now. And so I appreciate you letting me talk about it today, and I appreciate whatever you can do as we move forward with the, and I very much appreciate your prayers that they look with favor on this grant. So thank you so much. The other thing is we're seeing a lot more refugees, and by refugees I mean oil refugees. There's been a big influx of people from the 3 affiliated tribes because of the environmental degradation up there. They have second homes here, or they've moved here permanently to Bismarck just to get away from all of the environmental concerns. And I think we're seeing some of that with Standing Rock as well. So I think the census figures are not accurate. I think we have a much larger population than they would tell us. But it is very, very difficult to get the population together. And I think one of those reasons is when you move into the urban area, you're basically on your own. And so what I've been trying to be able to do with Sacred Pipe is to really give Native people a safe space to be able to come and congregate with other Native people and meet with other Native people. We have a monthly meeting that we hold, and we usually have a meal, and we usually try to have some sort of a program where people can get educated about the community and how to live in the community. And one of the big issues we've been dealing with lately has been the backlash from the pipeline. We have a lot of kids in the school system that are, seeing some comments made and things like that. And so I work a lot with the schools and in the school system to provide services for our Native youth, where they can, safe spaces for them to be able to talk about those things too. But it is difficult because it's hard to, it's very hard to keep in contact with the population. And I definitely don't have the money to do big media campaigns, so it's kind of like the Moccasin Telegraph is the main thing.
So I didn't have a pencil, so I couldn't write down. You had said there were 3 things that were your goals, and the second one was about representation. Mm-hmm. I know there's more than political. So what are the aspirations in that regard? And
the discussion, so the 3 community engagement teams came out of a visioning session that we held with the community. And one of the things, one of the questions that we asked about to bring out this vision is, when was a time that you felt really included in the Bismarck-Mandan community and you felt part of it? And every single person in the room talked about the 1 or 2 years that the United Tribes Parade went in with the Folk Fest parade, and there was one parade, and it featured Native people, and you saw them out. It wasn't just the Shriners or one random float. They were featured throughout. And so what that group talked about was having more events like that, where you see us visually represented in different places, and people know that we're part of the community and we feel welcomed as part of the community. So it was those types of things that we were supporting. So Sacred Pipe did a Armed Service Day event back in May of this year. I don't know if anybody saw that, but we did a parade across the Memorial Bridge, and we brought together the Native and non-Native veterans. And so we had Native and non-Native veterans groups together in the parade. And it was a very small parade, but we held a ceremony afterwards down at Sertoma Park, And it was so meaningful and so powerful, and we had so many good comments from the veterans that said, you know, we were a brotherhood in the armed services, and we should be a brotherhood afterwards, and this event is long overdue. And so it was, you know, again, it was kind of that spiritual guidance that took us to that place and allowed it to be a good event where, you know, you didn't see divisions there. It was just everybody working together, and it was, so it was like, it's those types of events that they want to see more of, where we're just really integrated and welcomed and, you know, all together. And I dare say that the events at the Pipeline have only strengthened that resolve, because they're such a integrated event, you know, it's such a, people coming together so well, so our website is sacredpipe.net. And we've got like all of our past events up there. We've got a calendar of all the events that we have now. We're starting a series of events for our youth. So on Monday nights, we have Lakota language classes. On Tuesday nights, we have our Tuswecha Beading and Cultural Academy. On Wednesday nights, we have our basketball skills and drills camps. And then on Thursdays, we have our traditional cooking classes. So we're trying to get kids engaged in after school and evening activities that aren't, you know, so they're not just out doing nothing and saying they're bored, but actually doing things. And we're going to be, you know, switching that calendar up. So we're doing other things, longboarding. We're going to be doing video storytelling, digital storytelling, things like that kids are going to do, gaming things. So kids are all different things so that kids can come in. We have volunteers that want to teach singing and drum making. So we have all these different ideas about things to do. And we've had a lot of volunteers that have stepped up and volunteered to do that. So it's because I'm just a one-woman band, it's been a little hard to do the outreach piece of it, but we try to, I give everything to Grace, and she gets it up just as soon as possible on the website. So that's really the best place right now to kind of find out everything that's going on. Oh yes, and I do have we have a Facebook page too, just Sacred Pipe Resource Center on Facebook. So if you look us up there and like us on that page, you can see that we try to keep that pretty updated too about what's going on. So. And we still have, we have a weekly show on KDAC, 102.5 FM, and we air each Friday and each Monday. And what we do there is we try to interview community members from Bismarck-Mandan that are American Indian, and we just want to be able to showcase the people who are living here. And it's not the big important people with titles or fancy, you know, fancy jobs or positions in anything. We just interview basically everyday people, because we want the community to see these are everyday people. These are the Native people that live in this community. They go to work each day. They raise their kids. They may have interesting hobbies. They may have interesting experiences to share. And so that's what we do with that show. It's part of that integrating the culture, is just letting people know that we're here, we're human beings. You know, we have the same hopes, dreams, fears as everybody else in this community. And so that's one way that we do that sort of outreach too. So. I just wanted to mention too, because I know that a lot of people think, well, Native people, you know, for health services, they get Indian health services. And you can go to the IHS clinic, and it's really kind of a misnomer. The people who live here in Bismarck and Mandan are really the ones who go without medical services. On Standing Rock, because the Indian Health Service is so drastically underfunded, the priority is for the people who live on the reservation. And so even though the rules have opened North Dakota as a CHISDA, which is a contract health service delivery area, and all Native people should be served at the Indian Health Service centers, that doesn't happen in reality. And so a lot of the people that live in this community, first of all, you have to drive to the Indian Health Service hospital in Fort Yates. If you possibly get in, they may not cover any contract services here, so you can't get services in Bismarck. You'd have to be seen there. And secondly, they prioritize life or limb at the Indian Health Service Hospital in Fort Yates. So it's very hard to be able to be just seen. We do have, Native American people have the opportunity to get into the marketplace, and in our health fairs, we've had health navigators there who have signed people up and have tried to get more Native people on Obamacare. A lot of the elders, and part of this is that there's a lot of rules in Medicare and Medicaid that deal with assets and your level of poverty. And so Native people who own assets such as land, fee land, things like that on the reservation are afraid to apply for Medicare and Medicaid and things like that because of they're afraid that the government can at some point come in and take more Native land because of their need for healthcare services. And so it prohibits it keeps a lot of Native people from going to get those services. And we've been dealing with kind of the same sort of misinformation about the marketplace and Affordable Care Act and what that does and what that provides. So a lot of it is really just getting people educated about what they're eligible for and they're not being penalized, and they can use these services to get health care. So, but I think Native people for so long have felt like they just don't have access, that they're not really looking for ways to access health care. And so that's one of the ways that we want to do outreach, let people know that a small community health center, they're more apt to come in and ask questions and, get answers than a huge corporation where they really don't have time for that. They're just trying to get people in and out as quickly as possible. So a community health center can provide more opportunities like that to let people know what's available and then how to advocate for themselves as well.
Our closing words are written with Frederick Gillis. May the love which overcomes all differences, which heals all wounds, which puts to flight all fears, which reconciles all who are separated, be in us and among us, now and always.